This talk is about autoimmune issues and about the immune system because you can't really talk about autoimmune without talking about what is the immune system and what can go wrong with it. So I want to introduce myself. I'm a medical doctor, originally from Seattle. Had a long practice there in a place called Bellevue, and moved here 2.5 years ago to open up the Eagle Clinic. And our Eagle Clinic initially was on Cottonwood Court, and then we moved here in August. And my practice is a combination of sports medicine and regenerative orthopedics, which I'm board certified in, and functional medicine. And I've been doing functional medicine for probably about 28 years, which is up there with the most experience of people in the world doing functional medicine. I used to teach for the Institute of Functional Medicine. And so my specialties in functional medicine are in autoimmune diseases, in all brain-related issues, fatigue, arthritis, fibromyalgia, viral diseases, Lyme and mold, and all those kind of challenging things, and GI, tough GI things. I got interested in autoimmune conditions years ago because what I found was people were getting an autoimmune disease, going to a rheumatologist was trying to choose, quote, a biologic for them, and then they could get another autoimmune disease. And then they would go in and ask the rheumatologist, why did I get this? And the rheumatologist would look at them like they were crazy for asking, well, let's just see if we're going to choose another biologic. And then you also know that on television, if you watch live television, 3/4 of the commercials are actually drugs for autoimmune conditions. And when they list at the end the possible side effect profiles, it's unbelievable. It's like you can't I stop breathing almost every time during those TV shows, just listening to the side effect profile. Well, at any rate, I pride myself in being a doctor that gets at causes and underlying issues. And so I developed an approach to autoimmune diseases. And I also took a deep dive into something called functional immunology. And functional immunology is a part of functional medicine. Most doctors trained in functional medicine do not have any training in functional immunology. So I've studied hundreds and hundreds, I don't know if it's been thousands at this point, of functional immunology, which is learning about the immune system, the most misunderstood system in the world in medicine. I want to talk about, if you don't have an autoimmune condition, how to decrease your likelihood of getting an autoimmune condition. Okay. How many of you don't have an autoimmune condition? Raise your hands. How many of you don't want to get an autoimmune condition? Okay. How many of you have an autoimmune condition? Raise your hands. How many of you do not want to get another one? Raise your hands. So that's one of the things I'm going to be addressing, how to not get autoimmune conditions and why they occur. Okay. How many of you have heard the term boosting the immune system? Have you heard that term? That's completely inappropriate. Things don't need to be boosted. Don't get me started about booster shots. Okay. Something doesn't work, you just do more of it. So that's not appropriate, but this is different. This boosting of the immune system is inappropriate. We need to balance the immune system. We need to modulate the immune system. What's really interesting, the immune system is one of the most fascinating systems in the body. It's there for protection, really. And it needs to be balanced, not boosted, balanced appropriately. Okay. So I'm going to be talking about the immune system and how to keep it in balance and what are some signs that it's out of balance. Okay. Then I'm going to talk about, how can, a person with an autoimmune disease be approached not only with a biologic, which, remember, that system of medicine is you have this, so you get that. How many brain cells does that take for me as a doctor? Almost none. One of the biggest compliments my patients give me is, hey, Dr. M, it looks like you're actually thinking about my case. I can tell something's going on there, just like, that's a compliment. Besides, you help me get better or whatever. Or I know I got a tough case, but I appreciate you working on it. We're going to talk about a whole bunch of stuff. Let's first talk about the immune system. It's designed to be a defense system to prevent viral infections, bacterial infections, parasitic infections. And if someone gets a wound, like you get a cut, so that you don't die, so that it defends you in a sense. Okay. We have different parts of the immune system. So there's a part labeled the innate immune system, innate, I-N-N-A-T-E. That is primarily the natural killer cell. Now, I've developed a great fondness for the NK cells and the natural killer cells. It sounds funny because it sounds like they kill things, but they are very important cells because you know what they do? Two things. They survey for cancer developing in your body and they get rid of it before it multiplies. Don't you like that happening? And they fight viruses and bacteria that the body has never seen. Because if the body's seen it before, that's the antibody system. The Th2 system kicks in, produces antibodies. If the body's already been exposed to something, that's why we have an antibody system. But we have a system that doesn't use antibodies, which is the innate immune system. The innate immune system, natural killer cells, is rather interesting because a lot of people are walking around with low numbers. Lots of people. And what I'm finding in my practice is that when I ever do a measure of blood count on people, people have low white counts. Your white count is less than 5,000? It's low. What does that mean? Probably your natural killer cells are not going to be up where they need to be either, because a good sign of just where things need to be is just having an adequate white cell count. And I've been seeing over the last 10 years, white cell counts going through the tubes, the toilet, the tank. Why? There's different reasons. Viral infections, metals, mold, all kinds of things might be able to do this, but it's kind of important to at least get a one-time measurement of the natural killer cells, both the numbers and the activity. So I tell my patients like this, like, okay, your natural killer cells are, karate experts. Well, you want them to have a double black belt. So that's the activity. What's their activity? Yellow belt, black belt, double black. I want mine to be double black belts. And you want a lot of them. Okay. And a lot of people, the activity is low and the numbers are not high enough. Now, there's another system that works with the innate system called the Th1 system. And the Th stands for T helper. But it's a terminology for white cells. So what is very interesting is the Th1 system is very connected with the innate immune system, so the natural killer cells. And what happens is many things can cause imbalance, and then that system goes too low. But when that system goes too low, you're prone to viral infections, you're prone to cancer, and you can't mount an adequate inflammatory response. But when it goes too high, people get too much inflammation. So it can get out of control, and that's called an autoinflammatory condition. When there's too much natural killer cell activity and too much Th1 activity, it's kind of unusual, but that does occur, but it's not that common. Then the Th2 system is the allergy system. So the sign that that's out of control is people's, eyes are running, their nose are running, they're congested, they have asthma, they have hives, and that system can get totally imbalanced. But what's unfortunate is when that system gets imbalanced, what happens is it decreases the activity of the Th1 and innate immune system. So it's like this Th1 and innate immune system is very sensitive to other things happening in the body and the immune system, and it gets suppressed too easily. And it's not good, because I don't know about you, but I want my natural killer cells taking out every little cancer cell that tries to develop in my body and my patients' bodies so that people don't get cancer. Cancer prevention, big deal. Keeping our natural killer cells in good numbers and activity, really important for cancer prevention and to keep the immune system in balance. Then we have another system called Th17, and Th17 is related to hollow organs like the intestine, the sinuses. Whenever there's like overgrowth of bacteria, these hollow organs, the Th17 system goes nuts and goes too high to defend against it. So that relates to irritable bowel, small intestinal bacterial overgrowth. That's how those things can relate to the start of autoimmune conditions, because they imbalance the immune system as well. So there's a lot of things going on in regard to balance of the immune system. Then there's the other issue. So there's the dendritic cells. They're called dendritic cells, and their job is like the cops. They're supposed to go around and go, are you part of the body? Are you part of the body? Are you the intestine? Are you this? Or are you me? Basically, are you us? And the dendritic cells line the whole gut. Like they're the immune system on the other side of the capillaries, the dendritic cells. And if something gets through there that shouldn't get through there, then they're like, what is this? This is a really big molecule. I've never seen this before. I'm going to tell the lymph nodes to mount a response to this, and then there's going to be an immune attack. And that happens in leaky gut. So leaky gut or intestinal permeability is a big reason why autoimmune diseases are developing and why people can develop second, third. I had a woman come in, 27 years old, 4 autoimmune diseases. And when you heard the list of what they were, your eyebrows would raise and go, holy crap, this is bad. Because lupus is the worst one. She had that. She had Hashimoto's and rheumatoid. I was like, whoa. And I said, did anybody ever talk to you about prevention? No, nobody ever mentioned that. But I was just appalled by that situation. Nobody should have 4 autoimmune diseases. And if they did, the doctors aren't doing their job, which is prevention. But rheumatologists don't know what prevention is. So they just keep treating them for these things. So we have to think about causes. So one of the causes is intestinal permeability or leaky gut. Let me check with a lab test. But that's the concept of molecules getting in the dendritic system, looking at these things. I don't know what this is. This is too big. I've never seen this before. And the worst thing to get in is called LPS or lipopolysaccharide. This is parts of bacteria lining, and the immune system goes quite inflammatory in relationship to that. And it also can cause fatty liver. So one of the biggest causes of fatty liver, which I'm going to do one of these month talks on sometime because there's an epidemic of it now. And I don't know about you, but I don't want to be on some list waiting for a liver. So very high percentage of the population now have fatty liver. The biggest cause of it is intestinal permeability, leaky gut, and lipopolysaccharide from bacterial lining getting in, going in the gut, and then the immune system going after that and causing inflammation and fatty liver. Bad. So intestinal permeability, big deal, because it's foreign molecules, big molecules getting in that should not be getting into the blood system, the capillaries, the dendritic system monitoring. I don't know what this is and going after it. Okay. Another thing is chemicals, toxins, pesticides, herbicides. We are being exposed on a daily basis, weekly basis to so many chemicals. Can you imagine if you're an immune cell and you're looking at a brain cell, because this goes on in the brain too, and most of you don't realize this. The worst thing is to have autoimmunity of the brain. And now I'm seeing this in a lot of people with brain fog. And I get these tests, and they get immune antibodies to parts of their brain tissue, or they could have balance issues, brain fog, memory problems. And rheumatologists don't even know this is possible, except they heard about it with, MS. So MS is a classic autoimmune disease, but there's causes for it. Okay. So if you're an immune cell, you're like, okay, I'm looking at the brain cell, I'm looking at the intestinal cell, and there's pesticides in here. There's herbicides in here. At any rate, foreign chemicals. One thing we need to do is ideally eat organic as much as possible. Grass-fed, not corn-fed. Eliminate the GMOs from our diet. And if we have autoimmune conditions or don't want to get them, probably get a really good food allergy panel that not only has IgG testing, but also has complement testing, because complement tests the immune system in a way that IgG doesn't, and then eliminate the foods that we're allergic to that we might not even know about. Because you get a food allergy setting off the immune system, and that can set off the immune system in other ways. There's some concepts where the immune system gets set off by something, and then the alarms go off elsewhere and other things start going on. There's terminology for this. So one thing that can help is actually saunas, because if we can get these toxins out of our body and lower the load, then, it's going to help our immune system. So I'm an advocate of saunas and infrared to penetrate as deep as possible, and low EMF. You don't want to go into a high EMF sauna, but, you can get one for your home, or, there's Perspire and some of these other places that you can do saunas. And just like I tell people, like, you want to sweat for at least 20 minutes in there, but you don't want to get chest pain or anything, but and you want to bring organic towels in there and wipe it off and then put it in some plastic bag, because those towels are then toxic waste, and then, wash them. But saunas could be very helpful for management of autoimmune disease and then prevention of autoimmune conditions. Okay. Now, what about your immune system? What if you said, you know what? I am really curious. Is my immune system in balance, or is it not in balance? There's a test from a company called Cyrex Labs, Cyrex, that can measure your whole immune system. I think it's called the lymphocyte map. It's an amazing test. It was developed about, I think, 4 or 5 years ago. I used it on a number of people and could tell me everything that's going on in terms of the immune system, so I then know how to balance it. There's no other way to do it, but we can measure the natural killer cells. So, like, the poor person's way to do this is just measure the natural killer cells of white count, but that doesn't tell me everything. Like, this is the ultimate way to do it. Every day I'm trying to be grateful, find some good things, planted some columbine in my garden that I look at every morning before I go to the clinic to heal people. And so I'm looking for the good stuff. So one of the good things is this test that measures the whole immune system. So that is a way to get it all mapped out, which I think anybody with an autoimmune disease should at least have that test because, I mean, the immune system and autoimmunity, that's not checkers, it's chess. And I tell people, I'm playing chess here. This is a chess game. There's a lot of, okay, how about what's going to happen next? What's this move? How are these things connected? What's a goal that I have for my patients with autoimmune? Okay, so can you tell someone you can absolutely, totally get rid of it 100% so it can never be triggered? Theoretically, no. Theoretically, no, but you can get it to a condition where it doesn't get triggered easily and people do not have autoimmune flare-ups. So let me talk about what an autoimmune flare-up is. An autoimmune flare-up has been termed the Clone Wars and Star Wars, where these cells that are ready to go after the thyroid or some other tissue, because it gets triggered by something, whether it's something that happened with leaky gut, or someone got exposed to a lot of chemicals, or they ate gluten and they weren't supposed to do that, or they had a food they were allergic to, or they're exposed to mold, or whatever triggered it, have a major autoimmune flare-up that lasts for weeks and weeks because of the Clone Wars, because some of these cells that are like, here's 100 of them, go to 1,000,000 in 3 days. Because these are the cells that remember the thyroid or something else, and they're going after it. We don't want the Clone Wars from happening, okay? The way to decrease the Clone Wars from happening is to figure out what the triggers are and to minimize them, and also to heal the guts and to lower the toxin load in the body and to balance the immune system. So one of the goals of anybody with an autoimmune condition is to decrease flare-ups, autoimmune flare-ups, but also create a condition so it's very hard for another autoimmune condition to develop because it's really bad when other autoimmune conditions develop, right? Now, if you said, is it even possible for an autoimmune condition to go 100% away? But in functional immunology, from one of the brightest guys in the world, he said, don't tell your patients that you can get rid of this. And there are naturopaths and other doctors that say, well, we'll just get rid of this. Like, I don't think that's appropriate. Let's say, let's have some appropriate goals. Let's balance your immune system, decrease your likelihood of developing another one, and decrease the triggers and decrease how bad the flare-ups are and get this really tuned up. Okay, that's what I think is possible. So how do you decrease these triggers? It's like, so here's the concept. You're walking on a trail in Boise someplace, and here's a trench, and that's an autoimmune flare-up. And you don't want to get too close to the trench, right? And drop in there, and then like, oh my God, 3 weeks, my joints are hurting, or that's bad, or whatever. So the best way to do that is to figure out what's going on in your immune system. Is the Th2 system out of control? Is the Th17 system way up there and out of balance? Do we have to treat, these hollow space infections? Because I said the Th17 system goes haywire. You get small intestinal bacterial overgrowth and all this gut stuff going on, or sinus issues, or any place where there's a hollow tube that's got chronic infection. Tune that stuff up, decrease any food-related triggers, decrease EMF, because I think EMF actually affects the immune system, decrease chemicals you're being exposed to, and then there's other ways. So what's rather interesting is, like, if I find out that someone's innate immune system or Th1 system is too low, there's a product from a company called Pure Encapsulations. And we actually use these things. So this is called innate immune support. Now, I had my natural killer cells checked, and both my mother and father got cancer. I don't want to get it. And my natural killer cells are a little bit low. So I take this to keep them higher and to get the activity higher. So that the guy that actually designed all the functional medicine immunology curriculum designed these products. That's why I like them. And then this one, if someone's allergies are out of control, this tunes that down. Because then when you tune that down, the immune system gets balanced. So these are a couple things that we use in here to sort of balance that. And then stress can really affect the immune system because stress can actually set off an autoimmune flare. I don't know if any of you have noticed that. Can. And not getting enough sleep can perpetuate or set off autoimmune flares because the studies have shown that the body will become grossly inflamed when the person has gotten 7 or less hours of sleep. Actually 6. That's the magic number. You got to get above 6. So the body will stay inflamed for 4 days. And they've measured blood in people where they just, have them sleep in a lab, get them 6 or less, measure their blood for 4 days, inflammatory molecules in their body for 4 days that will screw up the immune system. Now, they've used lab rats to do this, and I don't know how they do this, but they've actually got their cerebral spinal fluid, and they have inflammation molecules in the brain for 4 days. So now we know the brain and the body are inflamed when people aren't getting enough sleep. So sleep, really important. Stress management, very important. Exercise is important because it helps in some ways keep the immune system healthy. Too much exercise can actually disable the immune system a little bit temporarily, but the right kind of exercise, like going from nothing to walking, is good. They used to say that heart zone 2 is adequate. I don't believe that anymore. I think heart zone 3 is necessary, which is 70 to 80% of the heart rate. If people can get into high intensity interval training, that can be incredible, but some people can't get into it. But I design exercise programs for the immune system according to what my patients can do, because exercise is really important for the immune system. Now, biologics. When I work with a patient, I don't take them off the biologics, but one of my goals is to wean them off if we can, and only use them when there's a really bad flare-up and we need to use them. Because according to the television and what I've read, the list of side effects like death, horrible infections, and cancer. Who wants to get that? And so it's like a ticking time bomb to be on these things. It'd be a little bit difficult. So I don't really want to be those. So my goal is to wean people down and only use them in brief spurts when they need them, but not use them all the time. There's a lot of fallacy about this. Those drugs do not prevent flare-ups. They decrease the end organ damage if there's a flare-up happening, but they don't decrease a flare-up, and they don't have any effect on another autoimmune condition developing. I can't remember the names of all of them, but that a biologic means it works on one pathway. It literally only works on one pathway only. Does not balance the immune system. It actually suppresses a pathway. And the reason why there can be so many side effects is because most things in our body are there for a reason. So if you stop them, you can have untoward side effects. I don't know if any of you remember that when they created these drugs for inflammation, Celebrex and Vioxx, and said they were the best things since sliced bread. Back there, that expression used to be used since sliced bread. Now sliced bread is not really that healthy, but people thought it was healthy according to the dysfunctional food pyramid, which was so wide on the grains, right? Like, stock up on 9 servings of grains and you'll be healthy for some reason, like they wanted an obesity epidemic. But best thing since sliced bread. And then it was found out that they were actually, even though they were selective PGE2 inhibitors, that we needed something they were suppressing, and people were getting heart attacks. So then Vioxx got taken off the market by the FDA because it was leading to an increased risk of heart attacks. But the interesting thing is Celebrex is the same type of drug. It's still available. So people are being put on Celebrex, and, it was a great idea. It's just that, unfortunately, suppressing that biochemical was harmful. So you always have to look at the benefits and risks of any drug. I am all for these biologics when they need to be used. And I say, stay on it or get on it when it's appropriate, but not forever. Does that make sense? You don't want to be on these things forever, but thank God we have these things, because there's a real epidemic of autoimmune conditions. And so let's get into a few more causes. Believe it or not, mold, biotoxins can trigger autoimmune conditions, and viruses can. So one of the things that was happening with COVID is viruses were getting reactivated, like Epstein-Barr, CMV, herpes, all these viruses, because COVID was disabling the immune system, the innate part of the immune system by COVID. I don't remember the exact mechanism of how it did it. And so people were getting severe fatigue, and sometimes it was related to Epstein-Barr and some other things. So now, we know that some of these viruses can trigger autoimmune diseases or start them. And the mold and the different toxins we're being exposed to. I mean, the problem is we're being exposed to so many chemicals in what we're using in the air and everything that it's hard to know which ones are triggering it and what. There's no way to know that. Lyme disease can trigger it. The Lyme co-infections can trigger it. So there's a lot of, and there's a book that I have in my medical library called Chronic, and the whole book, it's written by a doctor and a singer. How did a doctor and a singer write a book? The singer had an autoimmune condition, and she finally found this doctor that determined she had Lyme disease, treated it, and then the autoimmune condition went into remission. And they wrote a book together called Chronic about how so many of our chronic diseases today are related to infectious organisms, potentially. Really interesting book. I don't recommend reading, alarming things after 8 o'clock at night. So if you read that book, read it before, but it's not that alarming because that causes stress and that could trigger an autoimmune. How did genetics play into this? People can have a genetic predisposition, and it's usually on the HLA genes. So there's certain genes called the HLA that like, for instance, like if someone's got celiac and then they have HLA-DQ, I think it is 2 and 8 or what, they're going to be much more predisposed to have a full-blown case of celiac. So all these autoimmune conditions actually have genetic potential predisposition, but that doesn't mean someone's going to get it. So remember, genes aren't on fate. They're a part of the equation for what someone's dealing with, that they could, get something. So for instance, like the ApoE4 gene, very related to whether someone will get dementia. But if I know someone's got it, then I can be very aggressive with all the interventions. So to help prevent dementia, or if they have early dementia, then be very aggressive so they don't develop it. That's what the talk last month was about. So there are genes that can be obtained. The problem is, say you have an autoimmune disease and you get genetic testing, I haven't found it that valuable necessarily. There are some people that have a lot of symptoms that they've seen a bunch of specialists, they haven't been able to diagnose it. So remember, diagnosis is just putting a name on it. It's not looking at causes or the whole picture. It's just putting a name on it. And so that's helpful in terms of, quote, insurance reimbursement or whatever. But so here's an interesting concept. Some things that might seem like autoimmune diseases are not, like Lyme disease. That can masquerade as anything. Bartonella, mold biotoxins cause a lot of inflammation. So, I mean, one has to consider not only autoimmune disease, but these types of things conditions that can masquerade with many symptoms. I do that in my practice. See these complex patients and figure out what's actually going on, but I also look for causes. So it may be that someone's run antibody panels and nothing's showing up. That means it's not an autoimmune thing, but it might be a chronic infection thing or a mold biotoxin thing or something else. I have one guy who nobody could figure out what he had, and he was being exposed to massive electromagnetic fields, just massive. 42 years old, he could barely think and focus, and nobody could figure out what was wrong with him. And so we looked into that, and that's what that was. So there's all kinds of things that are causing problems in people these days. That's the way I would approach it. There's too many things for convenience these days that are affecting our health. In terms of the immune system for your diet, first of all, you need to not eat things that you have immune reactions to. And I'm telling you, so you can't just say everybody's allergic to dairy and wheat, but anybody that I see that has an autoimmune condition, they're off of gluten, period. I don't care whether they have celiac or not. It's a problem. And they're off of all genetically modified foods because that can really damage the gut and other structures. So glyphosate that's in Roundup that has been sprayed all over our planet is in genetically modified corn, which is most corn, unless it's organic. And it's in soy, it's in canola oil. And that's horrible for our immune system. And so mushrooms are actually an interesting food. I advocate that people, try different types of, stir fry mushrooms, different types, because they have something called beta glucan in them and some other things that are good for the immune system. So like, when you make a stir-fried vegetable, put some shiitakes in there. Lion's mane, really good. Portobello. The bottom ones are okay. They're not that great in terms of all the things they got in there, but any mushroom is probably, you know, helpful for the maybe helpful for the immune system. Like I told you, like my diet for autoimmunity is is organic, non-GMO, lots of colorful antioxidant types foods. Now, sometimes you have to take people off of all grains. There's something called an autoimmune paleo diet where you take people off of all grains, and sometimes that helps. There's another type of diet where you take people off of high lectin foods. So that gets into all kinds of things. Here's one concept. You really want to minimize your use of what's called seed oils. They come from seeds. It's omega-6s. It's really not healthy for the body. And I think grapeseed oil is in that category. I've looked at all these oils to cook with, and you need oils that will handle heat. It does seem like avocado oil is one of the healthiest ones to use. It really is. So I advocate people cook with avocado oil unless it's low temperature. Then you can use, organic olive oil, but use organic olive oil and make your own salad dressing and stuff, because the balance of oils in the body is really important. I didn't talk about this, but we really need a good balance of omega-3s to other oils in the body, because otherwise we tend to be more inflamed. So as a dietary thing, we need to get intake of more omega-3s and good, what's called flavonoids you can get good flavonoids from actually olives and olive oil, although some of the species have more of these beneficial antioxidant flavonoids. Did you know that wild blueberries are much better for you than regular blueberries? Because they have a very high amount of that purple stuff. Do you know why they have that? Because blueberries that grow in the natural environment, or huckleberries, they're the best. They're stressed out berries. You want to eat stressed out berries because they produce all this purple pigment to protect themselves. Crazy. You never thought about, like, I got to eat stressed out berries. Okay, we're officially over. Thank you for coming.